Hello, we're here with Carol Peterson, compounding pharmacist, discussing local anesthetics and general anesthetics. Carol, what is a general anesthetic?
Well, a general anesthetic, I'm sure everybody's familiar with. It's administered IV, and it will result in a total loss of consciousness while major surgeries are being performed. A local anesthetic is intended for use in a certain location and a small numbing effect. You're probably all familiar with the numbing effect of anesthetics dentists use when they're about to do a procedure. So you realize that that effect of the anesthetic in your mouth does not travel all the way through your body.
Thank you. Now, we're only going to discuss one of the local anesthetics, the only one the clinic used, which is lidocaine, its generic name, xylocaine, its trade name, and lignocaine, its British Australian name. What are the doses for therapeutic doses, for the anesthetizing doses of lidocaine?
One of the most commonly used doses is 1% or 2%, even more common, appearing in some mouthwashes and things. And those are commercial products. Doctors may use these ointments. When you get up to about a 300 milligram dose, and this would certainly depend on the strength and the amount that you're using. So for instance, as you use in your office, you use a 1% solution. That means in a 1% solution you have 10 milligrams of the active ingredient, which is the lidocaine. 10 milligrams, compare this to the toxicity levels that have been ascertained at possibly 300 to 500 milligrams. So this is a very, very tiny dose. One of the other interesting things that all the local anesthetics, and you know them by the cane at the end, is at those very little doses, physiologic doses, you get an interesting property, and it resets the membrane potential. And
that's why we're using it.
Yes.
Resets the membrane potential of the
nerve cells.
And also the cells in general.
Yes. Yes.
And what this resetting or balancing of the nerve cells and the other cells does is it enhances and normalizes the normal function of the nerves. So we're using what's called the physiologic dose instead of the
pharmacologic dose, which might be higher in order to numb your tooth.
So at 10 milligrams, and we dilute that further 9-fold, so we have a total of 10 cc's, are we giving, when we get immediate improvements, are we getting these immediate improvements of pain and function because we've anesthetized the people?
No way. I would like a stronger dose if you were going to put stitches in my skin.
Exactly. So the toxic doses are 300 milligrams, and it's really not an issue, and higher because we never even get close to that.
No.
Thank you, Carol, for explaining that.